So I'd like to welcome you all today to our Transitions Learning Collaborative. I'm Karen Winkowski, Administrator for Harford County Office on Aging. We're pleased to see all of you again. And we're super excited today to be able to have our partners from the Harford County Health Department here to present about the care coordination services and some of the other things that they do at the Health Department. Many of you, I'm sure, work with the Health Department on a regular basis, and if you don't, maybe you'll learn some programs and services today that might be helpful to you and the people that you serve in your work life. So I want to give them as much time as possible today, so I'm going to introduce Mary Jo Beach. Mary Jo is the Director of the Division of Care Coordination at the Health Department. So Mary Jo.
Okay, thank you. Okay, good afternoon. On behalf of Dr. Russell Moy, our health officer, I want to thank you for attending our training, our TLC training session on such a beautiful afternoon. Today, staff will provide information on 4 programs offered by the Harford County Health Department through the Division of Care Coordination. The Division of Care Coordination serves Harford County residents, all ages across the lifespan, Medicaid recipients, individuals with qualified health plans, Medicare recipients, commercial insurance recipients, or the uninsured. The Division of Care Coordination assists anyone needing help finding a doctor, navigating the healthcare and community resource system, or needing assistance remaining in the community. Today, you will receive an overview of the following care coordination programs: the Care Coordination Plus program, which we call CC Plus, the Hospital Outreach Program, which is HOP, HOP, the Adult Evaluation Review Services, which is AERS, and Nurse Monitoring, which many of you are also making referrals for. We're going to have 4 sections, so if you would please hold your questions till the end of each section, and then while it's fresh in your minds, we can answer your questions. So I'd like to introduce our nurse supervisor with Care Coordination Plus, and she's going to tell you about our CC Plus program. Kim Prout.
Hi everyone, it's good to see you. I'm Kim Prout with the Care Coordination Plus program, and Care Coordination Plus is a primary point of entry at the Health Department for clients in need of significant care. So it's like a one-stop shop. You call my number or make a referral, and I will disperse the referrals out to the programs that are needed. It's a rapid referral program for Harford County residents whose health needs extend beyond traditional medical care. So we look at the whole holistic person and their psychosocial needs to address everything. The program is funded by the Maryland Community Health Resources Commission, and we work in partnership with Healthy Harford, the WATCH team, Wellness Action Teams of Cecil and Harford County. And Harford County is, Harford County Health Department is the only health department in Maryland offering this program. So we should feel very lucky. Let's see. Eligibility criteria. This is a free program to anyone in Harford County. There's no cost, so they do have to be a Harford County resident. Again, like Mary Jo said, all ages across the lifespan. We work with newborns all the way up to, I think our oldest client that we've seen this past year was 103. Whoa. Yeah. So, and Care Coordination Plus is insurance blind. So we accept clients no matter what type of health insurance they have, Medicaid, qualified health plan, Medicare, commercial. We work with veterans, and then also the uninsured and the undocumented. So why would you make a referral to Care Coordination Plus? First of all, I receive referrals from a lot of different agencies and resources throughout the community. Social Services, Office on Aging. I get self-referrals. Family members refer, physicians' offices, the school system. So our name is out there. If your client or someone you're providing services to needs help finding a doctor or navigating the healthcare system, if they're taking care of a disabled child or an elderly parent and just don't know what to do next, if they're in need of help with long-term care planning, having difficulty paying for health care and prescriptions. They're in need of discharge planning, hospital discharge planning or rehab facility discharge planning. They may be in need of housing due to eviction or homelessness. They may have had a qualifying life event resulting in a change in health insurance. They lose some type of health insurance and don't understand, why or what to do next. These are probably our 3 biggest reasons for referrals, as everyone in this room knows. Transportation, they're in need of dental care, and they're looking for food and energy assistance. So those are really 3 big topics. And I just wanted to let you know that some of the MCOs with the Maryland Medical Assistants are now offering some type of dental coverage, I believe starting 2018. So that's a help. So once we receive a referral, the first thing I always ask, and you guys know this, is do you know what type of health insurance they have? Because that just starts the path. So we get the referral, I review it, I contact the client to see exactly what they are in need of. We know what we think they're in need of, but what are they expressing? Then I can make referrals to appropriate health department programs or community resources and agencies, even prior to actually meeting with the client face-to-face. I offer CC Plus services through enrollment, and what they need to do is sign a consent form and the HIPAA form. And there's no time frame for Care Coordination Plus. I work with them for as long as we need to get things settled. There's no mandatory number of phone calls, visits. I always tell them we're really laid back and we're just going to go at your pace. So we provide telephonically, and it's a home-based program or a community-based program, so I'll meet them in their home, or we've met at the library, restaurants, parks, whatever works. So I assist them with applying for health insurance, navigating their health insurance benefits. Medicare benefits is always a big one. Linked them to clinical safety net services, physicians, social workers, those types of things. And like I said, I make referrals to other health department programs such as behavioral health. We have tobacco cessation. We have a dental clinic, women's wellness, health services. It just goes on and on. We also assist the client in accessing community resources and agencies within the community. For example, behavioral health services. We make referrals to the Maryland Access Point. We sit down with them and we help them apply, complete the paperwork for different applications, such as food assistance, long-term care medical assistance. What else? The Quimby Slimby. We help them with energy assistance applications. So like I said, just if in doubt, just send them our way. And like I said earlier, we offer services in a holistic approach. We look at the client themselves, but we also look at the home, who else is in the home, what relatives may be in need of services that they hadn't even thought about. Again, it's at no cost, and we offer interpreter services if needed. So you can make referrals by calling that number. That is my direct line at the health department in Swan Creek. And in your packet, there's a referral form you'll take a look at. You can fax that to me. You'll see a spot where it says client signature and date. You can get a verbal permission and just note that on there for me. The other thing is we ask for the social and or the MA number. Don't, make that, it's not a big deal. I use that basically to see what type of health insurance they have. So if that intimidates a client, tell them, don't worry about it. I'll call them and get that information. And I think that, and if you have, any questions, just call me and see if it's an appropriate referral. Any questions? Yes?
Do you have a counterpart in Baltimore County?
We don't. We're the only health department in Maryland.
Baltimore County doesn't have any of this stuff, right?
They don't have the Care Coordination Plus program. No.
I just wanted to be sure I hadn't missed something.
So the question was, does Baltimore County have a counterpart? And they do not. Yes, right now it's 21 and under, unless it's a pregnant woman. And they're located in Edgewood. Oh, is our dental clinic age, is our age specific? And yes, 21 and under, and they can be pregnant woman. Any other? Well, thank you very much. And I'm going to introduce to you Susan Germeroth. She is our hospital outreach nurse. Thanks.
Okay, whoa. Let's start that again. There we go. Thank you for coming today. I really appreciate all the interest in the health department programs. It's important for us to get it out as much as we can, and so this is a great way to do it. We'll start with the eligibility criteria. My clients have to be Medicaid recipients and over the age of 18. And that does mean they have to be that full Medicaid. We're not talking about Quimby or Slimby. We're talking about the red and white card. They have to be currently hospitalized or recently hospitalized, and that's a little bendable there. They could have been out of the hospital a month or so, and finally somebody thinks they need to contact me. Or they're at risk of long-term care, and this program is only one of two in the whole state. The other county is it Worcester or Wycombe? Worcester has a hospital outreach program. And so that's just 2 grants within the state for this program. Okay, the services that we provide. We do discharge planning, monitoring services to Medicaid recipients in subacute, acute, and long-term care facilities. We help Medicaid individuals in the hospital and long-term care transition back into the community, and that encompasses a lot. We provide information and assistance with community support services, and I am a registered community health nurse. We do a lot of hands-on assistance. I do a lot of home visits. They need help with the applications for food, for energy, Meals on Wheels, transportation, senior housing, and I do take an advance directive to each home visit or community visit and encourage them to think about that and do that as well. I do a lot of med reconciliation when they come home from the hospital. A lot of times their medicines have changed. Their one is discharged or DC'd, and another one is added in its place, or perhaps a pill is cut in half, that kind of a thing. So I go over all that with them, and I do encourage them to look through their medicine cabinets at home and discard all their old medicines. So many of us, myself included, hold on to old prescriptions, especially pain medications, which is a big deal in our county now. We don't want any extra pain medications in our closets or stuffed in our drawers, wherever we keep them. And you would have some young teenager perhaps want to try to come in and take your medicine. So, and we're trying to keep the young population as healthy as well, so there's nothing for them to look for in our homes. So I ask them to do that, and I give them a list of sheriff's departments and police departments where they can dispose of them properly. I do encourage family attendance during the home visit if I can, a daughter, a brother, a mother, whatever. And home visits are made by appointments. I don't knock on doors and surprise people. I call them and make a visit, an appointment. Okay, so other services that we provide. I do the NRI Level 1 screen, and I do all kinds of referrals to partnering agencies, many of which you are sitting right here in front of me. The Office on Aging, Community Action Agency, Maryland Access Point, just to name a few. And I do referrals to the Harford County Health Department programs as well, AERS, which will be coming soon, MCHIP, which is the insurance division, administrative care coordination, behavioral health. We do some cancer screening, referrals, and tobacco cessation program as well. That's a big one. I also do referrals to faith-based community assistance such as furniture, rental assistance, prescription assistance. I do referrals for durable medical equipment that you can get either at the Office on Aging or at the Lions Club. And then sometimes I do deliver the shower seats or wheelchairs or whatever if they don't have a family member who can pick them up. All right, I still provide monitoring that post-hospitalization primary care provider appointment. Their discharge instructions, the last thing it says is please make an appointment with your primary care provider within 3 to 5 days when you get out of the hospital. So they don't always make that 3 to 5 day window, but I do try to make sure that they've got that appointment, it's made, and they have transportation to keep it. I reinforce the specialty health care appointments. Perhaps they've had a heart attack for the first time, and I try to, Google all the cardiologists in the county and give that to them and say, now it's your turn to pick someone out. And perhaps we'll look through the area. Okay, you live in Bel Air, let's choose this one. You live in Havre Grace, let's choose this one. And get them that cardiologist, that specialty doctor, so they can be seen for more follow-up care. I do connect individuals with lots of support groups in the county, such as NA and AA, grief and caregiving groups, lots of the churches. And quite a few of the hospitals also have those kind of supports groups going on. So I try to connect them with that, and I am able to provide naloxone training in the home so that the holistic approach you were talking about before, if they happen to have a grandson that's living with them and they're addicted and haven't done anything about it, and I can at least give them some information on some recovery programs and so forth, and I can train grandmom perhaps to know how to administer the Narcan to her grandsons should the need arise. Other services, the way I do my services are by phone, in the home. I visit in the hospital. I visit in subacute and long-term care facilities, or out in the community. I've met with people in McDonald's or here at the senior center and so forth. And of course, the program is no cost. I do provide the interpreter if they need it, either telephonically or to go with me to a home visit for limited English-speaking individuals. And I refer to a lot of the Living Well classes, disease-specific. I do a little diabetic education, congestive heart failure, COPD. I do that in the home. But of course, going to a 6-week class would be much better. So I try to encourage them to do that by going to the hospitals or other partners in the community that could help them with more and more information how to keep themselves healthy after a heart attack, say. And how do you refer to HOP? You make a referral to Kim, and I get the referral from her. Any questions?
How many people are in your department?
How many people are in my department? Me, myself, and I.
We already knew that.
Anything else?
So is it, you can have Medicare with the Medicaid, or are you just doing the full Medicaid?
As long as it's full Medicaid, I will take them, even if there's a supplemental or something else along with that.
Okay.
That's a good question.
So how do you prioritize? I mean, you must get a ton of referrals. How do you prioritize, how you're seeing those patients?
Well, I try to call them at least, I'm sorry, the question was how do I prioritize who I see first? Generally, I try to call them within 2 days, 2 business days, just to make that first contact. After that, I usually book about a week ahead, and then I get them an appointment, and I go into the home, And normally, I will call the following week after I give them all this information. I give them a binder with all kind of stuff in it that maybe I didn't mention all of it. So they can keep that, they can look at it. A week later, I call them and say, okay, so did you get a chance to look? What do you think? Or what questions do you have? Do you need me to help with food stamp app or whatever? I try to make them as independent as possible, but I want them to have some time to digest things, because it's a lot. There are a lot of things out there in this county that are really helpful. Not enough, but a lot. And so from then, I may call them once a week or once every 2 weeks, and then I might go on a cycle of I'll call you once a month. Most of the time, they don't want to let go of me. They like the fact that I do a home visit, that I call them. The majority of my clients don't have family involved. They don't have children nearby. They don't have friends, relatives. They don't have church. They just don't have a whole lot of support. So when they hear me call, oh, thank you so much. Let me tell you what, whatever. So I have a hard time getting rid of them. I really don't. That sounded terrible. You know what I mean? Yeah, I tend to keep their charts open too long because they're needy. So I might keep somebody open as long as a year. And I try to pare it down to 8 months or maybe 6 months, but I hardly ever close anybody before 3 months. There's just a lot going on.
Your load is at any one time, like just an average?
What is my load at any one time? It's probably about 25 or 30. I try to, if I call a new one, add one to my list, then I try to look through and discharge somebody who, I've had for 6 or 8 months, that kind of a thing, so that I don't get too carried away. Yeah. Any other questions? All right, thank you so much.